Alrighty. So I'm going to tell you all a little bit about pharmacy and pharmaceutical operations. So first, what's pharmacy? I'm sure almost everybody's probably seen or been around one. If you've been in any grocery store, you've undoubtedly walked by one. What they do is they dispense and sell drugs, medications, prescriptions. Fun fact, over in the UK and Australia, they are called a chemist, since they are kind of the chemistry equivalent of a doctor if you view a doctor as more of a biologist. So, pharmacies generally nowadays are located in retailers, drugstores, but they're also located in hospitals, clinics, and even in labs. Generally, pharmacies do not manufacture or produce anything of their own. They buy them through an individual wholesaler who actually manufactures them. So they just basically sell drugs. They don't have any part in making them. So we're going to focus primarily on retail pharmacies. So there's two main jobs, the first of which is a pharmacy technician. So their primary duty is to aid pharmacists. So what they do, they collect information needed to fill customer prescriptions, so they're going to be the people you talk with. They're kind of like the front end of a pharmacy. So they'll be operating the register, making sure they can answer any questions for you. They also do a little bit of stock work, such as measuring out medications and prescriptions, looking at packages and labeling all the prescriptions, organizing and stocking the inventory, and of course helping customers, which can include all sorts of things like payments, helping through insurance claims. So if you go through a hospital and you need to get a particular shot or medication and your insurance covers it, they take care of all that paperwork. So they also handle patient information, so obviously they're liable to things like HIPAA. They also answer phone calls, so they basically do all sorts of little customer service tasks. And they also help customers meet with pharmacists if they so need to. So the majority of them work within retail pharmacies, about 70% of them, but some work in hospitals, which is roughly the last quarter of them. Most of them are full-time, and you really just need a high school diploma or equivalent to get through that. There are some college programs that are like the CLA program that are just a 1 year, but it's not required to get into it. So their median pay is about $30,000 annually, which is about $15 a year, assuming full-time. Their expected job growth is 12% over the next 10 years, and there's currently 402,500 total pharmacy techs currently working in the market as of 2016. So important qualities to have are customer service skills, since that's the primary thing they're going to be doing, be detail-oriented, math skills, and such for doing any of the stocking and inventory, listening skills, of course, back on customer service, and organizational skills, back to the stocking. So, of course, the main thing in a pharmacy is a pharmacist. Typically, you're going to have one or two of these. They're going to act as sort of the manager at a pharmacy while also taking care of a lot of the more technical things, such as preparing the medications and vaccines. So they fill the prescriptions themselves. They verify that the doctors gave them the correct thing. They make sure the prescription is correct. It won't interfere with any of the patient's current prescriptions or medications, because having a bad reaction would not be good. They also will administer vaccinations, particularly with flu shots. I actually did find, interestingly enough, most states, they just do flu shots. They don't do any other vaccines. In Oregon in particular, it's relatively new that they do all the other little vaccinations nowadays. In the past, I guess physicians did most of it. So their job scope of practice is expanding quite a bit. And they also do the bookkeeping, supervising, and essentially all the managerial stuff that you would expect from any sort of job. So there are several types of pharmacists. Community pharmacists are more what the atypical retail sort of pharmacist is. They work in their small little clinic within either a drugstore or a general grocery. They generally interact with patients quite a bit, since there's only 3 or 4 staff working at a time. They directly administer shots, and they do quite a bit of the work essentially, as opposed to sitting in the background and not interacting with customers. And that's about 60% of all pharmacists, so the vast majority of them work in retail. The clinical pharmacists work in hospitals. So what they do is they often go on rounds with doctors, and they basically help give them advice as far as what medications to use for patients, and help give information to patients if they want to know more about a particular drug, and make sure, oh, is this safe to use? Is this going to have any weird side effects? So essentially they kind of walk around as the encyclopedia on that. They also do the same sort of work in that they do prepare any prescriptions, they make sure everything's correct for the patients, and they'll often directly administer them, if not give it over to another pharm tech. So consultant pharmacists are relatively new as far as what they're up. In the past, they didn't really have as much of a job as they do now, especially with a lot of elderly patients, since our healthcare is getting a lot better at keeping everyone alive longer. They basically go around to nursing homes and anywhere that you can find elderly patients who will need advice, any kind of extra knowledge on medication, how to take the medication, how to use it properly, how to not overdose on it. And that's rapidly growing compared to the rest of other types of pharmacists. And then there's pharmacists who work within the industry, so they do R&D, manufacturing, marketing, sales, research, all that fun stuff. The latter two currently are in the minority of less than 15% of total pharmacists, but both jobs are growing. So, education. Pharmacists need a lot. So, at the bare minimum, they need at least an associate's degree, but a bachelor's is preferred to get into most pharmacy programs. They also have to pass a test called the Pharmacy College Admissions Test, which is a very difficult test and needs a baseline level of knowledge on most types of chemistry. So the programs themselves to get the doctorate are between 3 and 4 years. And 4 years is generally more common. Some programs, like there's one in Hillsborough currently that's 3 years. But naturally, if it's a year less, there's probably going to be a lot faster of a curriculum and probably more technical skills as far as practicums. After getting their doctorate, they have to pass 2 exams that are federally administered, first of which being the North American Pharmacist Licensure Exam, and then the Multi-State Pharmacy Jurisprudence Exam. Both of these are federally required, and many states also require individual ones, just to make sure everybody's licensed by whatever state's purview. So naturally, lots of tests, lots of education. You have to be very smart to be a pharmacist. So, their median pay is $122,000 a year, which is roughly $60 an hour. Their job growth is about 6% over the next 10 years, so half as much as a pharm tech, but such is the life of someone who needs so much education. Then there's approximately 312,000 pharmacists actively working in the US, which, if you recall the statistic from the pharm techs, is only 100,000 less. So they're quite close in that regard. And then important qualities to have are analytical skills, communication skills, computer skills, detail-oriented, and managerial skills. Since they've got a pretty wide scope of practice nowadays, it pays to be pretty multi-talented and be able to handle a variety of situations. And there are my citations.
All right.
Any comments, questions, or concerns?
Looks good.
All right.
Jamin?